Gaetano Morello. I'm a practicing naturopathic physician. I practice a BC Women's Hospital in Vancouver, British Columbia. I treat complex diseases, fibromyalgia, chronic fatigue syndrome, myalgic encephalomyelitis, and Lyme disease. And one of the things I use in practice when my patients really utilizing integrative medicine and mixing mainstream with alternative medicine. And one of the things I share with a lot of physicians is the fact that there's an enormous difference between nutraceutical medicine and pharmacological medicine, and that when we prescribe a product, like for example a tetracycline for a patient, we're pretty secure that that patient, no matter which pharmacy goes to or she goes to get that product, it's going to be tetracycline, as opposed to a nutraceutical product. When you recommend a nutraceutical product, there could be 30 different types of curcumins, for example, and that becomes a problem. So one of the things that I try to really spend a lot of time in is learning about what nutraceutical ingredients actually work. So today we have two of them here that are absolutely effective. And the first one I want to talk about is AnxioCalm, because I think this is a very unique ingredient, and I won't talk about something unless I give it to over 100 patients. So I think I've given this to maybe over 600 patients. And what's unique about this product is, so many people have stress in their lives, and we often blame stress for a lot of different things. And you know what? Very few people actually understand why stress is so problematic. And I want to spend just a minute just explaining to you what actually stress is doing physiologically in the body that creates the problems that it creates. And so think about this one. I'll give you this easy analogy: the lion and the zebra. So when the zebra meets a lion in the jungle, the zebra is going to be what? Stressed out. Why? Because the lion's going to eat it. So the zebra has two choices: either fights the lion or runs away. It's smart enough to figure out, I better run away. So in order for it to run away, a very important reaction happens. It's called the sympathetic response. And the sympathetic response sends signals to the gastrointestinal tract to take blood away from the cord and pull it to the peripheral tissues, the zebra's limbs, so the zebra can run faster. It makes a lot of sense. So the zebra runs for maybe 5-10 minutes, beats the lion, and everything's good, right? Right. But what happened to the gut? Well, the gut is really fascinating, because we know that 80% of our immune system is located in the gut. We know that there's more neurotransmitters produced in the gut than there is in the brain. We know there's over 100 trillion bacteria in the gut. And this is the kicker. What separates everything inside your gut from your bloodstream is actually one cell. It's a paradox, because that one cell lining has to be strong enough to block the 100 trillion bacteria, to block all the gunk that's in your gut from getting inside your blood. At the same time, has to be permeable enough to allow nutrients to get inside the blood. So it's a paradox. So what happens when there isn't blood flow to the gut? What happens when you're in a stress response? Well, guess what? The integrity of that one cell lining breaks down, and you get increased gut permeability. It's like a roof on the house where there's holes in the roof and it rains and all the water goes inside the house, making a mess. Well, it makes a mess. Now imagine in our everyday lives, humans aren't stressed out for 5 minutes. They're stressed out for a day, a week, a month, a lifetime. And what damage is that doing? It's doing a lot of damage. And one of the things that we see with our patients is that when they're under stress, symptomology increases dramatically. And when that stress is reduced, symptomology goes away. So one of the interesting aspects of treating these patients, what can we get them that reduces anxiety? Well, when I found this, I was flabbergasted, and I'll tell you, started giving 2 of these tablets to my patients, and they saw results within 15 to 30 minutes. Let me repeat that. Within 15 to 30 minutes, which in medicine you just don't see. And so, what is this stuff and how does it work? Well, this stuff actually comes from a plant that is very well known called Aconia, Aconia gustifolia. And Aconia, when you think of Aconia, wait a minute, Aconia and anxiety, Aconia and stress, Aconia is an immune stimulant. Well, let me give you a little bit of background. I'll spend another minute on this. And the background is that Aconia has these compounds called alkamides, and the alkamides actually affect these system in the brain called the endocannabinoid system, and there's these receptors in the brain called CB1 receptors, and when you activate those receptors, things calm down. As a matter of fact, you also have another set of receptors, CB2 receptors, found in white blood cells, and when you stimulate those, the immune system goes up. And so this particular type of Aconia, they've actually concentrated the alkaloids, stimulating that endocannabinoid system, calming you down. So a phenomenal product for stress and anxiety, works within 15 to 30 minutes, which is remarkable, and it's pretty effective, I would say in 80% of the cases. So in medicine, you don't see that very often. So this is just a phenomenal product to take. It's safe, and I've shared it with many, many patients, so I really highly recommend the AnxioCalm. The other product is Curcumin headache, and remember what I told you at the beginning of this? That pharmaceuticals, you prescribe them, whatever pharmacy. Well, Curcumin is really one of the products that has a lot of clinical studies, over 5,000 studies with this particular ingredient, yet I could tell you right now that I would say 90% of all the curcumins on the marketplace, they're just not as effective. And the reason being, there's bioavailability issues, there are all sorts of different issues that really create problems with curcuminoids. So I think one of the things that most companies are trying to do is really trying to get curcumins that are bioavailable and that are effective. My whole focus is always on patient outcomes, and I've used curcumin on its own, this BCM95 actually, with great effects. I've given it to over 1,000 patients, and patients see results within 2 hours, especially when it comes to pain. Now this new one that they've just come up with, Curcumin headache, has a couple of added ingredients. It has the phenomenal anti-inflammatory combination of Curamin, which is very, very effective in reducing inflammation. Most headaches are what? They're inflammations, right? What do you take for a headache? You usually take ibuprofen or an aspirin. Well, you could take something that's more naturally based that has other real beneficial effects in the body called curcumin. And this particular product has B6, which is really great for the nervous system. We use B6 for peripheral neuropathies, but also has a magnesium ingredient. It's 300 milligrams of magnesium bisglycinate. And I want to point out bisglycinate because, people are very used to magnesium citrate and magnesium malate. But bisglycinate is interesting because we found that it doesn't have an impact, or as much of an impact, on the gastrointestinal tract. A lot of times when you take a lot of magnesium, you could get diarrhea or loose stools because magnesium is a muscle relaxant. Well, bisglycinate seems to have an added benefit that it saturates tissue levels to a higher degree. And magnesium has so many benefits. Over 200 enzyme systems are affected by magnesium. It's a mineral that we have low levels of in our bodies, and something that I prescribe to almost every patient that walks into my office because of these low levels. And so it has some really great effects on when it comes to inflammatory reactions and headaches. So here's another great product that you can utilize not only for headaches, but for all sorts of other conditions as well. I recommend this to a lot of my complex disease patients because it has so many different parameters of benefits. And curcumin is, one of the great ingredients of the plant, I think, because it has so many different applications. So here's two great products for you to utilize, and you can utilize them with confidence because they give you outcomes. And in medicine, we're always looking for outcomes, and here's two that really deliver on that promise.